You're listening to the Anesthesia Patient Safety Podcast, the official podcast of the Anesthesia Patient Safety Foundation. We're bringing you the very best from the APSF newsletter and website, as well as the latest information in perioperative patient safety. Thanks for joining us.
Hello, and welcome back to the Anesthesia Patient Safety Podcast. My name is Allie Bechtel, and I'm your host. Thank you for joining us for another show. We have a new podcast series that we are launching today. This is an exciting collaboration with OpenAnesthesia and the Anesthesia Patient Safety Foundation. For this series, we will be talking with OpenAnesthesia Summaries authors about important topics in perioperative patient care and patient safety. This is a great way to expand your knowledge on these high-yield and practical topics. Our topics today are perioperative drug safety and perioperative allergies and anaphylaxis. This falls under the APSF patient safety priority of medication safety. Stay tuned for my conversation with OpenAnesthesia author Juan Li, who wrote the summary and is a guest on our show today. Before we dive further into the episode, we'd like to recognize BD, a major corporate supporter of APSF. BD has generously provided unrestricted support to further our vision that no one shall be harmed by anesthesia care. Thank you, BD. We wouldn't be able to do all that we do without you. To follow along with us, you can head over to openanesthesia.org and click on the Summaries heading. Our featured summaries today are perioperative drug safety and perioperative allergy and anaphylaxis. Our featured APSF patient safety priority is medication safety. Head over to apsf.org and click on the APSF Priorities heading. Then click on Medication Safety. This priority includes drug effects, labeling issues, shortages, technology issues, and processes for avoiding and detecting errors. Let's take a moment to review the 2022 APSF Medication Safety Patient Safety Priority Group recommendations. Here we go. Number 1, the APSF should optimize the use of pre-filled syringes and pre-prepared infusions to reduce the chance for dilution or labeling errors and potentially minimize waste. Number 2, the APSF should implement point-of-care electronic medication scanning for medication checks and clinical decision support prior to medication administration, with auditory or spoken and displayed medication name, alerts, and other critical information. Number 3, the APSF should work with regulatory bodies and manufacturers to standardize medication vials and distinguish medications by class with color-coded labels to reduce errors. Number 4, the APSF should recommend the use of standard concentrations of medications across patient care areas, including the emergency department, ICU, and perioperative environments. Number 5, the APSF should develop online resources highlighting best medication safety practices, including toolbox, checklists, white papers, and more, tailored for anesthesia professionals who practice in facilities with fewer resources than large health systems or academic institutions, such as surgery centers, office-based settings, and community hospitals. There is a lot of excellent work being done by the APSF to help improve medication safety. This is such an important topic. Today, we are excited to be partnering with OpenAnesthesia to share their comprehensive, high-quality educational content. And now, let's meet the author as we review these important topics in anesthesia patient safety. Hello, and welcome to the show. Could you please introduce yourself and tell us a little bit about yourself?
Sure. My name is Juan. I'm right now a cardiothoracic anesthesia fellow at Beth Deaconess Medical Center, Harvard Medical School. So I'm currently in training now, but I was attending anesthesiologist for 3 years before I'm a cardiothoracic fellow. And before that, I was a resident here in the same hospital, Beth Deaconess Medical Center, for residency. And I graduated medical school in China, Beijing, from Peking Union Medical College in 2016.
Now, before we get into the open anesthesia summary, can you share with us some of the key takeaways?
So this drug safety, we focused on a couple key points. First of all, we talked about perioperative anaphylaxis, which is common and in perioperative settings. And we secondly focused on the newer medication drugs and also safety concern about the new medications coming to market. And then we talk about the practice and safety culture in the perioperative settings. Lastly, we put a couple of recommendations for improving medical safety for perioperative medicine.
Now, let's get a little bit more information about perioperative drug safety. Can you provide a brief overview and some background information for us?
So perioperative drug safety is a very critical area in healthcare, focused on preventing adverse events during anesthesia and surgery. Historically, medication error in the operating room were common due to complex environments, lack of standards, and absence of pharmacy support. So anesthesiologists often manage medications without computerized decision support, leading to errors from medical calculation, distraction, non-standardized drug preparations. So over time, efforts has been made to improve safety through standardization of drug concentrations and equipment, technology, and especially APSF Foundation has played a significant role in promoting these changes, I think. And also, additionally, post-market surveillance and initiatives like the FDA's Sentinel initiative have also enhanced the detection of safety issues with newer drugs. And despite these advancements, vigilance and continuous improvement remain essential to minimize risks and ensure patient safety.
What are some of the important considerations that we need to be on the lookout for with different anesthetic agents? Can you describe some of the current anesthetic safety issues?
Yes, I think regarding first part, anaphylaxis, we should definitely focus on the life-threatening conditions caused by the most common drugs we encounter for the anaphylaxis, like neuromuscular blocking agents, antibiotics. And so we should monitor like any cardiovascular collapse, bronchospasm, or multi-organ involvement immediately during the care of the patient. And once we notice anaphylaxis, we should discontinue the medication right away. And in the following days of care of the patient, we probably will think about doing serum tryptase levels test. And for focusing on the physiology changes, obviously cardiovascular, we will notify any hypotension, bradycardia during the anesthesia, respiratory change, bronchospasm, hypoxemia, GI like a rash, angioedema, or patient has nauseous vomiting for the pre-med, and also for other metabolic electrolytes imbalances like hypokalemia, and also some delayed drug effects like a delayed onset of anaphylaxis in the PACU settings. We should also focus on those pathophysiology changes above mentioned.
This is great. What are some additional safety considerations that anesthesia professionals should be on the lookout when it comes to using medications in the perioperative area?
So I think we should focus on preoperative assessment first. We should review the allergy history of the patient, the drug list, also the medication reconciliation, including identify the drug reactions with the patient, asking the full history of the over-the-counter drug medications, pay attention to drug interactions, and secondly, we should also do some anaphylaxis precautions for high-risk drugs. We should be prepared for any anaphylaxis, even though the patient has no exposure before. And we should keep vigilant for the whole process to recognize the signs and symptoms earlier, and take protocol management to deal with these situations like anaphylaxis, shock conditions. And also regarding to newer medications, there are very limited data to how to, monitor this. Like the new medications coming to market, like Sugamidex or other medication, we have to be very careful about the rare side effects. And also we should focus on education and training about the situations that we cannot use of this medication. And lastly, I think we should put standardization and best practice into consideration, because all those new medication, we should implement protocol management of deal with the drug safety concerns. And also, I think the communication and safety culture should be put on the list as well. Adopt a just culture approach to investigate medication errors, focus on root cause analysis rather than punishment.
So there are some serious complications associated with medication errors. It is important for anesthesia professionals to remain vigilant during cases where they are providing anesthetic care. Can you review some of the best practices for medication administration?
I think we have a couple of things we can focus on. I think, first of all, we should do standardized process, implement standardized drug concentrations, preparation methods, and equipment to minimize errors. And secondly, we should implement technology integration, like utilize barcode readers, automatic drug delivery systems, and computerized decision support tools to enhance medication safety. And lastly, I think we need our pharmacy support as well to leverage specialized satellite pharmacists to provide pre-mixed solutions and pre-filled syringes, reducing the risk of errors during drug preparation.
Is there anything else that we haven't talked about when it comes to perioperative drug safety or anaphylaxis that you'd like to share with us today?
I think I probably missed something like is important as well, which is post-operative monitoring. Because most of the time we focus on pre-op, intra-op, but post-op is also one of the part we should be very careful. Because there are some medications had delayed reactions. We should educate our nurses, PACU teams about reactions, like monitoring and how to deal with drug effects. And there are also medications have some residual effects, like neuromuscular blocking agents, which happen not that uncommon in the PACU settings. I think this is the part we should also continue to monitor, even we finish our anesthesia care in the OR.
That's right. Anesthesia professionals need to be perioperative physicians and have an important role for patient safety in the preoperative, intraoperative, and postoperative space. Well, this
totally agree.
This was a really great review. Can you tell us what's next for you in terms of any upcoming research or projects? Finishing your fellowship? Yeah, it's a good topic. For my next steps, and I'm planning to stick around at the Massachusetts area. So I'm going to stay at the Beth Deaconess Medical Center and the community hospital at BI Lehigh system. I really enjoy working in the cardiothoracic anesthesia part. So I'm definitely will be dividing deeper into that area. And my main focus is going to be boosting perioperative patient safety for anesthesia. I've got a couple of exciting plans, like launching QI projects to enhance safety of transesophageal echocardiography, and also expand the use of point-of-care ultrasound and make sure our transfusion practices are as safe as possible. These are a couple of QI projects. And it's all about making things better for our patients and the team. Oh, that's great. Well, hopefully you will share some of those projects and findings with us with the Anesthesia Patient Safety Foundation going forward.
Thank you. Thank you, Allie.
Well, thank you so much for contributing to the show today. We are looking forward to continuing this collaboration between the Open Anesthesia Summaries and the Anesthesia Patient Safety Podcast.
Thank you very much. Thank you for inviting me today.
Thank you so much to Juan for joining us on the show today. We are looking forward to continuing this series and sharing more open anesthesia summaries with you. If you have any questions or comments from today's show, please email us at podcast@apsf.org. Please keep in mind that the information in this show is provided for informational purposes only and does not constitute medical or legal advice. We hope that you will visit apsf.org for detailed information and check out the show notes for links to all the topics we discussed today. If you like listening to our show, and we hope that you do, please take a minute to give us a 5-star rating wherever you listen to your podcasts, and share this podcast with your colleagues or anyone you know who is interested in anesthesia patient safety. This is a great way to expand our listeners and help make anesthesia safer all around the world. Thank you for listening and sharing. Until next time, stay vigilant so that no one shall be harmed by anesthesia care.